Hi, my name is Jennifer Trytten, and I'm Director for Infection Prevention and Performance Improvement here at Community Medical Centers. I work alongside with Dr. Libke, who is our Infection Prevention Medical Director, and I'm really pleased to be joining you this week for our State of COVID update. So the last 6 months have been quite a journey. What I've been most impressed with is the resourcefulness and the resilience of our healthcare workers as we battle this pandemic. This is hopefully a once-in-a-lifetime event for all of us. The one issue that we sometimes hear is that people are confused or concerned because the information on the news or that we're providing changes over time, and there's concern whether that the earlier information was incorrect. And what I always want to emphasize is that this is a new virus, so what we learn about it, we are quick to incorporate into what we do to battle it. If the virus turns left, we want to turn left right behind it. So I want to share with you some of the most recent information that we've learned from the CDC. So currently, our understanding of the virus has been updated with a lot of new numbers, and this is continuing to change. But what we know now is that about 40% of the transmission of this infection is from people who don't have symptoms. So why this is so important is that we need to remember that just because we don't feel sick, it doesn't mean that someone else around us couldn't get sick and they could have symptoms. We also are understanding more about how infectious is COVID. It's a little bit more infectious than the flu is what we're learning. One person on average will infect 2.5 other people during the course of their illness. One thing that we haven't known is if I don't have symptoms, am I as infectious as someone that has symptoms? And sometimes that seems intuitive that if someone is coughing, that they would be more likely to get someone else sick. What we've learned is that someone without symptoms is about 75% as likely to pass it on as someone who does have symptoms. So sometimes we get asked, why are masks so important? The most important reason is that we know that 50% of transmission is when people are not showing symptoms. So people don't realize that they're sick. So if people can wear masks at all times, it will really cut down on the number of people that potentially could be exposed. So why is this information so important for all of us in our day-to-day lives? It really stresses the importance of the things that hopefully we're all doing right now, which is wearing a mask when we're around other people, keeping 6 feet apart, even if we're wearing a mask. So it can be confusing and hard to keep up on all the changes, but if we all do our part, we will make sure that we are healthy as a community and that we can hopefully enjoy all of those get-togethers in the future. For more information, check out communitymedical.org/coronavirus.